about a project that combines the writing and research of people at Brighton and Sussex universities that links healthcare, sexuality and gender. So the project combines the research and writing that relates to the lives and the health needs of lesbian, gay, bisexual, trans and queer people in a range of populations and cultural contexts to challenge and deconstruct taken for granted normative assumptions about gender, sexuality and health. Queer theory originally emerged as a cultural critique of norms of gender and sex. Studies of health and illness show how significant the role of the normative is in the production and reproduction of identities and the body, and how norms are integral to the practices and processes inherent to the delivery of healthcare. The project explores gender and sexuality in health environments and how services could accommodate diversity. A queer critique of health fulfills the social justice aim of widening the scope for inclusion and citizenship. So queer readings of health challenge the views of sexuality as a natural feature with biological origins, proposing instead that sexuality is a constructed category of experience with historical, social and cultural roots. The biological base of sex is discounted and replaced by the discursive construction of sexuality that takes place in the realms of the social and the cultural. The assumed biological foundations of sex is questioned that results in the segregation based on a male-female binary. Queer theory suggests that erasure of identities based on the male-female, heterosexual, homosexual binary identities is problematic because the deconstruction of these binaries render the lesbian, gay, transsexual and bi communities invisible. So the project contests queer deconstruction of identity categories in order to make the health needs of lesbian, gay, bisexual and trans communities visible to inform healthcare provision and service delivery. The global health needs of these communities are overlooked even though legal decriminalization of homosexuality occurred in the UK in 1967 and the American Psychiatric Association declassified homosexuality as a mental disorder in 1973. Countries such as the UK, Australia, Canada, South Africa and the US have shifted towards equal rights for people in same-sex relationships. The UK passed the Equality Act in 2010 that forms the basis for anti-discrimination law, where sex and sexual orientation became protected categories in order to promote social inclusion. However, discrimination based on gender and sexuality difference remains prevalent in many parts of the world. LGBTQ people form a significant part of global populations. In England alone, it's estimated that the population amounts to about 3.3 million people, and in the 2000 census in the USA, 5% of the population identified as gay or lesbian, and Norway and Canada confirmed in health surveys that 2% of their population is identified as lesbian, gay, bisexual, trans in health surveys. So data for this population group in places such as Africa, South America, China, Japan and Russia is sparse. So a survey conducted by YouGov about social attitudes towards homosexuality showed that positive public perceptions of gay people in particular in the UK is prevalent, but recognise the extent to which prejudice still exists that leads to social exclusion and health inequalities. So the specific health needs of LGBTQ communities require consideration due to significant health inequalities, and these inequalities were noted globally around areas such as depression, self-harm, suicide, alcohol and drug use, smoking, breast, cervical and rectal cancers, youth homelessness, social isolation, specifically in older people, eating disorders, obesity, lower uptake of preventative health care, and screening services for sexually transmitted diseases. So, just to say that the World Health Organization is committed to mainstreaming gender and sexuality in order to address the gender-specific needs of people in global health communities. So the project that we're focusing on are revolving around those specific areas where we're writing about the research conducted in a range of different populations across the world. And it's a collaboration between Brighton and Sussex universities. Thank you.